So TB is an airborne infectious disease. It's actually really super common. The incidence rates are still fairly high globally.
I ended up finding out TCID after I was diagnosed in the hospital. I had a mass of TB on my spine. I had it on my hip area, my hip crest. It was so good to come here to open arms, not the fear in people's faces, just the concern, the care, the tenderness. It was all there and then some, I felt very comfortable.
Everybody's treatment is personalized and tailored according to what their diagnosis is.
There is a light at the end of the tunnel. There is life after TB diagnosis.
And we're here to medically, socially, and behaviorally treat the most complex cases of tuberculosis across the state of Texas.
Some of them feel like this is the end, and that's why they cry. They sent me to TCID to die. I'm like, no, they sent you to TCID to live.
I'm Lynette Palmer. I'm originally from Victoria, Texas, and I work in the surgical area in the hospital. I worked in sterile processing, and I've been doing that for like 24 years, but I've been in the medical field for actually like 4 years. I ended up actually finding about TCID when I got home, and doctors were concerned about my care because of the TB was on my spine. The health department was really concerned about my treatment and making sure that I was getting enough dosage to penetrate the bone to get rid of that bacteria. So they were consulting with Dr. Vasquez, who is a physician here. And Dr. Vasquez already felt that for them to really do proper care and proper dosage, that I would have to be monitored. So she asked them to ask me would I come to TCID, and I'm like, yes, immediately, because if I had known about this place from in the hospital, I would have came straight from the hospital here.
When a patient gets here, what they would expect is a lot of fun things. I know that sounds super weird, but we have a lot of really cool activities. So next week, we actually have the zoo coming. And so we're gonna be bringing in tons of different, I think it's about 20 different live animals to just play with the patients. They can interact with them and just learn more about the zoo and the natural wildlife. And that's just some of the things that we bring onto campus.
I've been at TCID for 5.5 years. It'll be 6 in September. We don't just get patients from the home health or from the hospitals. We get patients directly from the health departments. I really am the bridge between the community and TCID. I'm the first person that sometimes they'll encounter, especially with the health departments. That communication and support we have with that community, the public health nurses, is crucial to the success of TCID.
I've seen drastic changes. Leap in treatment was the privacy of the patients, and so they do have that here. Each person has their own personal room and shower. It's a big change since we moved in the new hospital.
We're not just a hospital. We're not just a 75-bed negative pressure facility. We have an entire campus here that's dedicated to the treatment of these particular diseases. So our goal here at TCID is to return our patients back to their communities much better, not just healthy from TB disease, but as best as we can get them back to that community.
They just, like I said, they just took a scary situation and made it so easy and made me feel so comfortable, and they cared about me. So for me, I will forever be grateful to this place.